I'm Nurse Sheena, and today I'm going to be showing you how to inject your Ozempic. Ozempic is a sub-Q injection and you self-administer it. So I'm going to be showing you today how to self-administer your Ozempic. I'm starting on mine today, and I'm going to be showing you how to use it if you have this on your own. So first, we're going to start by washing hands. We always perform hand hygiene first. Okay, so now that I perform hand hygiene, I'm going to open my box. So open your box, and inside your box you will have the package labels, and it comes with the needles and the pen. Okay, so you're going to open your needles. You should have 6 needles like this. And depending on your dosage, you're going to take your pen, and it's going to have this little dial on the end. You're just going to dial it up to the prescribed dosage. Okay, today I'm going to be taking the 0.5 milligrams. So you dial it up to whatever your prescribed dosage is, and you're going to remove the top. And then you're going to take one of your pen needles. It should look like this. And it's going to have a little tab, I don't know if all of them blue or not, but you're going to remove the little tab. This pen needle will screw right onto your pen, so you're going to screw that on. Okay, so after you have that on, I'm going to check my dose again. It is 0.5, and my pen is still capped at this time. So next, I'm going to take my alcohol swab, and giving yourself a sub-Q injection. When you self-administering it, you can give it in different sites. You want to always rotate your sites. So you can give it in the backs of the arms, in the abdomen area around the belly button or umbilical, and the sides of your thighs, and then in your buttocks at the back, your upper buttocks. Okay, so for demonstration purposes, I will be giving mine in my arm. So I'm going to raise up my sleeve. I'm going to take my alcohol swab, and I'm going to clean the area in a circular motion. Like I said, you want to give it kind of in the backs of your arm. Sub-Q or subcutaneous is just fat. So those are the most fatty parts of your body. The backs of your arms, around your belly button, in your thighs, or your upper buttocks. So now that I got my area clean, I'm going to remove my cap from my pen. And then you'll see it'll look like this. So next I'm going to remove the smaller cap. And y'all, the pen is so small. You see that needle? Very tiny. So I have my pen dialed up to 0.5. I have my cap removed. Y'all never touch the needle. You don't never want to touch the needle. It can cause an infection. It can cause your needle to be contaminated. So I'm going to take this, and then I'm going to just cross over like as if I'm hugging, straight across as if I'm hugging myself. And I'm going to go right in. And while it's in there, I'm going to press the button here until it clicks. And then I'm going to hold it here for additional 6 seconds. So 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi. Okay, so then you can take out your needle. And yes, so now you're going to disregard your tops. If you have a sharp container, you want to put your needle in a sharp container. If you don't, you can put your needles in a plastic bottle or empty jar to prevent needle sticks or anyone coming in contact with your used needle. So I'm going to disregard my needle. And when giving your sub-Q shots, you always want to kind of go straight in. But if you are kind of smaller or you have less fat, you can go in at an angle for someone who's really small. Now, when I get ready to give my next dose, which it will be next week, Ozempic is given once a week, or whatever your doctor says. Each person may have a different instruction based off of their health. So next time when I go in, if you are using a pen needle that has already been open like this one, you're going to uncap. You're going to follow all the same steps, but instead you want to just uncap it and put on your needle. You're going to uncap. You're going to take an alcohol swab. You're going to clean the top, and then you proceed with the same steps that I just did. Okay, y'all, so that's all for the video today. If you have any comments, please leave it down below, and I'll be back with more Nursing with Sheena videos, and I'll catch you in the next video.